Patient care is very rewarding for sure. It really is one of the most rewarding careers, but it can also be very, very frustrating.
Hi, everybody. Welcome back to Mangoes Not Lemons. All my employment nerds and all my future career buffs, we have a guest today that's going to help us understand a little bit more about a career in nursing. So for any of you that have ever thought, I want to go into the medical field, don't want to be a full doctor, I don't want all the schooling, but I really want to help people, I want to be there and maybe improve lives, we're going to learn a little bit about that today. So I'm going to turn it over to my guest, Dave Lamb. Welcome.
Thank you. Appreciate it.
So tell us a little bit about your career, your current position, and what you do.
Yeah, absolutely. So I am a registered nurse. I work for a locum tenens staffing company, which is just staffing for all medical professionals. So physicians, could be therapists, occupational therapy, rehab, that kind of thing. And also nurses, and even lab staff. My work in
lots of hospitals, lots of different companies.
All over the country, and sometimes outside of the country. Yep. Mainly our team right now, what we do is we do background checks for the physicians or whoever is applying for us, the applicants. We look at their background, we look at their education, we look at everything about them really, and just make sure that their application is clean and accurate and that they're going to be good providers for us. So,
all right. So make sure I understand. So you are, if I'm not mistaken, quality manager for a company that, for lack of a better explanation, vets somebody's talent.
Exactly.
So they're quality checking someone's medical certifications, their medical experience.
Yep.
You're almost backing them up, and then you are representing them. Yes. Medical organizations that could use their help. In the medical field, is it common for, let's say, a doctor or a nurse to work at multiple hospitals at the same time and work different shifts?
It's not uncommon, yes. A lot of facilities, or a lot of kind of like here where we have Intermountain Healthcare, right? Yeah. And they have several hospitals. Some of those physicians will have what's called hospital privileges at multiple sites. And so they could work at any one of those sites as long as they have privileges there. So It's similar to that. We could certainly send out a physician who goes to a certain work site, but they could have several sites that they work at. Just depends on what the client wants them to work at.
Okay. And the way you guys run, if you have a nurse, it's a certified nurse, they work for you, they're registered with your organization, you could send them anywhere in the United States, anywhere in the country?
Yep. In fact, a lot of times, most people will try to stay somewhat close to home so that they can still have access to it. But there's several who are just like, I want to check out what it's like to work in North Dakota this next few months, and they'll go to North Dakota for a few months. Yeah.
And the company puts up their housing, pays for their expenses.
Travel, housing, food, everything. Yeah.
And that's doctors and nurses.
Yep. Doctors, nurses, everything. Yeah.
Well, that's interesting.
Yeah, it's really cool.
So let's talk then. How did you get here? So when did you know you wanted to be a nurse? And then as you wanted to be a nurse, how did you get to managing the quality aspect of staffing nurses?
Right.
Give us a walkthrough of your career.
That's tricky. So with me, I worked actually for a health insurance company years and years ago, and I lost my job at that company. And at the time, I felt really unsure, unstable about my career. I wasn't sure what I wanted to do, where I wanted to go. I had no degree or anything at that point.
This was before college?
This is before college. Yep. I was probably about, I want to say 38-ish, something like that.
So when you graduated high school, you went straight into work.
Yep, straight into work.
And did that for a while.
Yep, did that for a while. Got married, had kids, and all that fun stuff. And when I lost my job, I really wanted to find something that was going to be more stable. My mother worked in the medical field. I don't believe she was a nurse, but she may have been a nurse assistant.
Okay.
And she would always tell me about how rewarding it was. And I thought, well, if I'm going to have a job that's very secure and stable, I also would like to do one that is rewarding. And so I looked into nursing. It felt like a good fit and went from there and got my degree. I now have my bachelor's degree in nursing. And, this job that I'm at now, I don't do any patient care, but it sort
Did
of,
you at one point?
I did.
Okay.
Yeah, I had to do about 3 to 5 years of patient care to just have the experience that I needed to work where I'm at now. We have to have that knowledge, that medical knowledge, to be able to do it.
Patient care hard.
It can be.
Okay.
I got lots of stories.
Okay.
But yeah, it's patient care is very rewarding for sure. It's when you see that you're helping people, it's amazing. It really is one of the most rewarding careers, but it could also be very, very frustrating.
And hard if you lose patients, I would imagine.
Yes, it's when you lose patients, it's tough. You miss out on a lot of things because nursing, much like a lot of other professions, is a 24/7 job. It's not a job where you get a whole lot of all the holidays and all the weekends and things like that off. You work all of that because there's always somebody who's sick and needs care. So
Yeah, and I could imagine there's not a lot of careers
Mhm.
that your patients and or the people you're working with commonly can pass away or
Right.
move on. Like that's a lot of emotional baggage to deal with.
Yeah.
And someone needs to realize if you're going into this career, there's a huge upside. You improve a lot of lives.
Absolutely.
You can impact people directly, but at the same point, you can lose patients.
You can, and it can happen quite suddenly. A lot of times you are aware of their condition. Obviously, you're aware of their conditions. That's why they're there. But sometimes some things can pop up that you weren't aware of, and it can turn everything upside down, so to speak.
Okay.
So, yeah,
So you did that for a few years. You got the years
Yep.
under your belt.
I did.
And then was this always the plan? Like, did you go into the direct patient care nursing
Mhm.
to be able to get into the management or the
Where I'm
quality
at now?
management? Yeah.
No, not really. In fact, I didn't really know anything about this type of work, except for the fact that when I worked at an insurance company before I went to college, they were in the same building as us when I worked for the insurance company. So I knew of the company and I kind of looked into them. I also had friends that had moved over to them and
Good word of mouth.
kind of
It's
talked
always
to them.
who you know. I'll tell you the good ones.
Exactly. So talked to them, found out, hey, if you need somebody, I'd be interested, and got hired, and I've been there ever since.
Okay.
Yeah.
So your degree in nursing
Yes.
required for this career path?
For this particular job, yes, you have to have that because there are certain, in anything in the health field or healthcare field, I should say, everything's regulated and regulated ad nauseum, just everything. And we're no different. We have certain rules and guidelines that we have to follow. And one of those is that we have to have medical trained staff who are doing these reviews that we're doing. So that's why it is a required part of being part of this job.
Okay. Are there certification programs that nurses can do that aren't a 4-year degree that can make them eligible to be a nurse? Or do they need the 4-year bachelor's degree in nursing to just start?
To just start in this particular job? No, you could do just the associate's degree and get your nursing degree that way. The bachelor's is not necessarily required, although times change a lot and they start, those requirements start. Yeah. But for now, yes, you can get your associates. In fact, that's how I started. I had my associates and got, into this job. And it wasn't until probably a couple of years ago I actually got my bachelor's while I was still working at this job.
Okay, nice.
Yeah. So,
All right.
yeah.
So the nursing, is it a certification? So they have to take different courses and certify, or is it an actual formal degree?
No.
Just the nursing piece.
For just the nursing piece, it is a degree. You have to, yeah.
Okay.
You can get an LPN, which is a licensed practical nurse, which is a 1-year degree. And then RN, registered nurse, is 2 years and above.
Okay. So that's good to know.
Yeah.
So an LPN is almost a more junior nursing level. There's certain
Sure.
things they can do, certain things they can't.
That's correct. Yeah.
And then the RN is a full nurse. They can help with all duties that might be in that
Yes.
category.
Everything that's within that scope of that license. Yes. You can
Okay.
do
So
that. Mhm.
how many of these careers, if somebody wants a career in nursing, how many of these careers are travel jobs versus I'm going to go to the same hospital every day? Like, what could someone expect in that kind of a career choice?
Yeah, so those are two definitely different paths to take. If you're going to be a permanent staff member and go to the same job every day, then you would be applying directly with that hospital or clinic
That
or
doctor's practice.
yes,
or-
exactly. And you would be an employee of that facility. Whereas a travel nurse is an employee of the travel nurse company. And there are several of them out there. I'll give a plug for RN Network. That's our group that we have that's in our company.
Check out RN Network.
There you go.
Travel nursing job.
Exactly. And RN Network, they find the nurses, and then they also have a group that finds the clients and puts them together. But they are employees of our company, not an employee of
Right. Legal
the facility.
employment record is
Yes.
RN nurses,
Yes.
and all their benefits, everything comes from you.
Mhm.
But then, so that gives them some stability.
Yes.
And then they will go out and work at different sites as needed.
That's correct. Yeah. And they generally I don't know a whole lot about that side of the business, so I don't want to misspeak, but they generally work with nurses that have several years of experience, and specifically in areas like the ICU.
Also
You know,
specialized.
so highly trained nurses, yes. Because those nurses tend to be able to go into a facility and be able to hit the ground running rather than have to go through a bunch of training and orientation and everything and then get going. You know, they want people to come in and start working right away.
Well, and lower risk, right? If they're
It's
seasoned
true.
staff, they're way less likely to make a mistake.
That's true. Yeah.
How about doctors? Do you do doctors as well?
We do. We do all the doctors, every specialty that we work with we hit them all.
Pros and cons. If
Mm-hmm.
somebody says, I want to be a nurse, what are the pros to being a nurse? We touched on it a little bit.
Sure.
But what are the pros? But what are the cons that we touched on this one a little bit
Yeah.
too. What are some cons that people might not realize choosing a career as a nurse? Like, I didn't realize so many of them travel, or that
Right.
so many of those jobs were travel appropriate, I guess, depending on your flexibility.
Yeah.
But what pros and cons? If you were to give, 3 to 5 pros, 3 to 5 cons,
Yeah.
viewers, pay attention, career choice nursing.
There you go.
Well, how would you just bullet point it?
Okay, so for pros, I would say mainly the satisfaction in the job. There's a lot of reward to helping people. So that's for me anyway, that's my biggest one. Also, it's great having to work only 3 days a week. You generally only work.
tell us that
No, I
part.
didn't. I didn't tell you that part. Generally, most places you work 3/12s, but it is hourly. So 3/12s, as you know, does not add up to 40. So it's gonna come up a little bit short of that 40 hours. But 3/12s is great, and then just
Is that common in nursing?
it is common in nursing, yeah, to be working
Okay.
3/12s. Yeah,
All right.
I mean it's not impossible to work a normal schedule like
Is it a rotating 12 or is it a fixed 12?
It's usually rotating. Yeah,
So a little harder.
Yeah.
I'm going to add that to the con list.
yeah, that can be.
That is a pro, but
Yeah.
that could be a con.
And it's all dependent on the different facilities. Like, I worked night shift, and that was always night shift. I never was, a few times I was asked to work day shift, and that was a little rough to go from that weird sleep schedule. But yeah, for the most part, you do the same 3/12.
Okay, so helping people, you have a schedule that gives you a little more freedom, maybe a better
Yep.
work-life balance.
Yep.
Okay.
And just the relationships that you create, not only with your fellow staff, but also with the patients. I have relationships that still to this day are just fantastic because of my meeting with them. Yeah. Yeah. So it's really an incredible job that way.
Okay, so what are some cons? We talked about
Cons.
one.
Yeah.
You can lose patience.
Yeah.
That's probably a big one.
Losing patients is a big one for sure. There are a lot of jobs that you can work at as a nurse where that's not as high of a risk as other places. Like if you work in hospice, you're going to be seeing a lot of people pass away. But if you work in, say,
General practitioners office.
yeah,
or
something like that.
family doctors.
Right.
Odds are much lower.
Much lower in those cases, yeah. But some of the other cons, you do miss out on a lot of family things because of the schedule. Holidays, weekends, things like that. Being a nurse, as I said, is a 24/7 job. And you will sometimes miss out on big holidays, Christmas, Thanksgiving, everything, and that's just because everybody does their turn working those tough shifts.
Well, I will say a pro. Let me add a pro and tell me if this one fits.
Okay.
A pro on the nursing side is you can pretty much go anywhere in the United States and someone's going to need a nurse.
That's
You have a
true.
pretty good location, geography of
Yes.
where your skills will be needed.
Absolutely. Yeah. That was one of the stable parts of why I went into nursing is knowing, hey, wherever I go, I will be able to find a job generally. You still have to be, of course, licensed in that state. And there are some states that have an agreement among the states where you
Make
can
sure-
travel.
We didn't touch on that.
Yeah.
So every state has their own licensing.
Yes.
Even though you're a certified RN, you will have to get certified again in every state.
That's correct.
But it's not a 2-year program. It's a pass a test.
It's a license. So you just have to get the license for that particular state. You can pass what's called the NCLEX. That's what gives you the degree of or the title of an RN.
Okay.
Then you can go to whatever state, apply for a state license, do whatever requirements are there. It's usually a fee and a test, and then you get your license and you can practice in that state.
Well, Dave, thank you very much for coming in today.
Yeah.
Everybody, hopefully you learned a little bit of something on nursing, what a career would look like, what to expect going into that career, some of the realities of a day as a nurse, and some of the strong benefits as a day as a nurse. So there's a lot to be said for people that dedicate their lives to helping other people. So thanks for watching today, and hopefully we'll catch you on the next episode.